Hello, my dear friends. I'm Dr. Vaishali Bharambe, Professor Anatomy. I've been teaching anatomy for many years and I love it. I'm the founder of VB Anatomy channel, which is a channel that teaches anatomy with a purpose. What is the purpose? I want to build the foundation for your clinical excellence. With that thought in mind, I have brought you Surgeon's Guide to Surface Anatomy, Abdomen Part 1 and 2. So I'll be bringing a whole series. There will be the surface anatomy for thorax, there will be surface anatomy for upper limb, head, neck region, and so on. In this series, we're going to talk about abdomen 1 and then abdomen 2. Come. So this lecture series, what does it do for you? It places before you the surface anatomy needed for abdominal surgeries. Why surface anatomy? Why does it matter? Come. So what happens is, in surface anatomy, you are outlining the organs inside on the surface of the body. How? See, there are certain landmarks which are visible landmarks or sometimes palpable landmarks. Visible landmarks like bones and cartilages, okay? In the abdomen, you can feel your costal margin, your anterior superior iliac spine. Sometimes, even the umbilicus and the nipple are all visible landmarks. What about palpable landmarks? You can feel cartilages, you can feel bones, muscles, tendons, even arteries for that matter. If you feel the pulsation, it becomes a landmark. Using all these landmarks, you're going to mark out the organ which is lying inside. Okay? So, question is, why discuss surface anatomy? See, surface anatomy is important for surgical aspirants and students because it will help to bridge your theoretical understanding with your clinical practice. How? See, so the organ is inside, you're able to locate it on the surface. Okay? How does it help? You are more precise in your physical examination. If you know that you're going to find the liver exactly here, your examination is much better. The safety and efficacy of your surgical procedures is much better. Therefore, you have successful patient outcomes. And that is why you need to understand surface anatomy. So, surface anatomy of abdomen part 1. So, what am I going to cover? Oh my God. Is this all this? No. This much. I'm going to cover surface landmarks. I'm going to cover this division of abdomen into quadrants. Next lecture will be all about individual organs. Okay. So let's start with all these surface landmarks. Where is your xiphoid process? This is your xiphoid process. See here. Okay. Articulating with the sterni, forming the xiphisternal joint. So how do you locate it on the body? Okay, the xiphoid process is thin cartilaginous lower part of sternum. Okay, and then it's easily palpable. If you feel deep inside, you are able to palpate it at the upper end of the two costal margins. And the xiphisternal joint is found at the level of T9. So below that triangular xiphoid, joint is at the level of T9. Where do you find it? Junction of the two costal margins. So with that, we come to costal margin. What do you mean by costal margin? Which ribs are we talking about? Are we talking about all ribs? No. We're talking specifically about 7th, 8th, 9th, 10th ribs. And of course, behind 11th and 12th. Please note here that the lowest level of the costal margin here is your 10th rib. Okay? Which will correspond to the body of third lumbar vertebra. And always remember the 12th rib may be short and difficult to palpate many times. So that's what you should remember about costal margin. Friends, if you're liking this lecture, then do please like, share and subscribe to my channel. Remember, this is the only way I can understand if my lectures are really helping you. I will feel encouraged to make more of these videos. Please also share your comments in the comment section and of course your doubts as well. I'll revert back to you as soon as possible. Hit that bell icon and let's continue with the lecture. Moving on to iliac crest and iliac tubercle. Take a look at this image now. This is your iliac crest, quite easily seen, anteriorly ending at the anterior superior iliac spine, posteriorly at the posterior superior iliac spine. If you join the two iliac crests with a horizontal line, it will mark the body of fourth lumbar vertebra. Similarly, go 2 inches posterior to anterior superior iliac spine, somewhere here, and you come to iliac tubercle. Were you to draw a plane through the two iliac tubercles, the plane would pass through the body of fifth lumbar vertebra. So see, now these are bony prominences which help you to create planes which are giving you the level, vertebral levels at that level. Okay, let's talk about pubic tubercle now. So this is anterior superior iliac spine. I'm sure all of you know where it is. Hopefully you're tying your jeans above it, but many a times you're tying your jeans below it. Okay, so usually the tie of your jeans often helps you understand where your anterior superior iliac spine is. Okay, now bony projection at the lateral end of the fold of groin. Right. Now here is your post-symphysis pubis. Here is your pubic tubercle. Extending between the two is the pubic crest. So anterior superior iliac spine, symphysis pubis, pubic tubercle, pubic crest. Right. That's the pubic tubercle, that's anterior superior iliac spine. Join the two. You have your inguinal ligament on both the sides. So you got inguinal ligament. How do you find it? Inguinal ligament lies just beneath the skin crease of the groin region. See here, you can see the skin crease. You will find your inguinal region lying just below it. Okay, there. Right. So now we've done all these. Let's talk about the abdominal wall itself. Linea alba. A small midline, sometimes a little depression exactly in the midline from the xiphoid process to the symphysis pubis right here. Okay, it's a bloodless connective tissue plane. That's it. Now, go a little lateral to it. And can you see these two lines? If you have strong abdominal muscles, then you will be able to see them. Okay, that's linea semilunaris, which corresponds to the lateral edge of the rectus abdominis, extending up till the tip of ninth costal cartilage, below till the pubic tubercle. Okay, you can see it in quite a few people. It's not like, of course, as the abdominal tone goes, this becomes little less well visualized. So now let's come to the fact that throughout this lecture, you're going to have such slides which have an orange edging to them. This is a slide where I'm giving you some clinical relevance. But I'm not going to read all this, and I definitely cannot teach everything because the lectures become overly long. So the theory is there for you to read. For example now, how does linea alba matter? Linea alba matters because it's a bloodless plane. It allows for midline laparotomy. It's a site for that. Okay? Or it's a site where you take an incision, there'll be minimal bleeding. So these are all the significances which are written in these slides. It's a site for epigastric hernias. It's a site for diastasis of the recti. Okay? And so on. So please pause the videos here and do read all this. Tendinous intersections of rectus abdominis, as we call the biscuits on the abdominal wall. Okay. So you can palpate them, you can see them, one at the level of xiphoid process, one at the level of umbilicus, and one somewhere in between. What is the significance of it? Is it only important because so many people in the world have decided to develop packs in the abdominal wall? No, definitely there is some importance beyond it. Again, the orange edge slide, please read through all this. It will give you a lot of information about clinical significance of these abdominal packs. Okay, right. So we've covered all this. Let's go on to talking about the umbilicus. So here's your umbilicus, a depression in the median plane, usually found at the level of intervertebral disc between L3 and L4. Later on, of course, as you lose abdominal tone, okay, the level of umbilicus no longer corresponds to this intervertebral disc between L3 and L4. Right, so these are some of the commonly asked questions. Nipple. In case of the male, the nipple is definitely quite a reliable landmark, lying in the fourth intercostal space, in the mid-clavicular line. See, take a look here. Fairly fixed in position, right? Okay, So, broadly speaking, we've covered the landmarks. Let's now talk about regions of abdomen, okay? So, for ready topographic reference of underlying structures, abdomen is divided into 9 regions by 2 horizontal and 2 vertical planes, something like this, right? Okay, but I'm going to show you this once. Remember, 2 vertical, 2 horizontal, but remember there are more. The vertical and horizontal divide your abdomen into 9 quadrants, but there are other referring planes as well. So as I teach you, I'll give you all the planes, okay? So first the 2 vertical planes. The 2 vertical planes pass through what is called as the a point between the anterior superior iliac spine and the symphysis pubis. Okay, mid-inguinal point. Superiorly, they are almost mid-clavicular. Okay, so 2 vertical planes, roughly mid-clavicular. What about median plane? Of course. And the plane that exactly passes through the midline of the abdomen will be the median vertical plane. Let's talk about the horizontal planes. As you can see, there seem to be 4. 2 blue, 2 orange. The 2 blue are the ones which help to divide your abdomen into 9 quadrants. The 2 orange are the planes that are also discussed. So there is transpyloric, subcostal, transtubercular, supracristal. These are all the planes we will be studying. Right. Transpyloric plane, very, very important. Focus. How do you draw the transpyloric plane? It's a horizontal plane that passes through lower border of L1 vertebra, drawn through the tips of 9th costal cartilage at a point where the linea semilunaris meet the costal margin. Okay. Various ways of drawing it. One is midpoint between your suprasternal notch and symphysis pubis. You draw a plane through that. Second is midway between xiphisternal joint and the umbilicus. You draw it through that. Lastly, you can ask the patient to keep his hand below the xiphisternal joint, and along the lower edge of his hand, you can draw the transpyloric plane. But it has to be the patient's hand, not your hand. Okay? Right. So there are various ways of drawing transpyloric plane. What are the structures that are found at the transpyloric plane? Now don't bother to read. I'm going to give you a lot of theory on the screen. Don't bother to read. Ask yourself, do I know this? Of course you know it. Transpyloric, tip of 9th costal cartilage, lower border of L1 vertebra. We just discussed it, right? Then the pylorus, the name is transpyloric. Obviously, it's going to pass through the pylorus of stomach. Okay, the portal vein is formed at that level. The hilum of kidney are found at that level. See, there is so much you already know about it. You just have to add knowledge. But always revise what you already know. Otherwise, every time you will keep on studying. There's no point in it. Some knowledge has to become, you must be confident about some knowledge and then you have to build on it. Come. So let's see how many we got left. Okay. So tip of 9th costal cartilage, pylorus of stomach, pancreas, neck, portal vein formation, gallbladder, fundus, hilum of kidney, origin of superior mesenteric artery, lower end of spinal cord. All these, you should remember all. There are many more, but I'm giving you these. Transverse mesocolon attachment. Now, why is it important to know the exact level of transpyloric plane? That's something that you should ask yourself. Why should I know this? See, you have a big abdomen in front of you. Where should you take an incision to approach a particular organ? You have to know that. You can't randomly take incisions, right? Not only should you know where the organ is, you should also know where other organs are in relation to it. For that, you have to know all the structures at transpyloric. Suppose somebody told you, oh, you can make an incision at transpyloric plane, you will come to the pylorus of stomach. They didn't tell you that at the same level the portal vein is formed. They didn't tell you lying below it was the neck of pancreas, right? So you have to not only know the organ you are trying to reach, but the other organs you will also find at that level. Okay? And then again, this is the orange edge slide, so you have to pause and read. You're going to need the transpyloric plane for gastric surgery, pancreatic surgery, as well as renal surgery. You can also use this when you're doing a radiological examination and at the transpyloric plane, what all are you seeing in this particular patient? So with this, we move on to the subcostal plane. Subcostal, below the costae. Costae means rib. So a plane that is drawn through the lowermost edge of the costal margin, that is at the 10th rib, is your subcostal plane, found at the level of upper border of L3 vertebra. So commonly they will ask you how to draw transpyloric and subcostal planes. Moving on, what is supracristal plane? Supracristal plane is a plane drawn joining the highest points of the iliac crest. It will correspond to the body of L4 vertebra. So I have a question for you. Where would you insert your needle for lumbar puncture? And how does it have anything to do with this plane? Come, I'll show you. So this is a section through your spine, through your vertebral column. You can see L3 body, L4, L3 spine, L4 spine. You can see the lumbar puncture needle has gone in through all these structures, piercing dura mater, arachnoid mater and subarachnoid space. Finally, you've reached into the spinal cistern and you're tapping CSF fluid. Till this, you're very clear. Okay. Question is, how would you reach that? How would you know where to put your needle? Okay. So what you do is you draw this Taffier's line. This line, which is the supracristal plane, which will show you the L4 spine. Once you reach the L4 spine, if you go above it, you would go in the L3, L4 space. If you go below it, you would go into the L4, L5 space. Got it? So that's how these surface anatomy planes begin to help you. Right. What is then transtubercular plane? Transtubercle, of course, passing through the iliac tubercles corresponding to upper part of L5 vertebra. See here. So can you see that these are the 4 planes? The blue ones, of course, help you to divide the abdomen into 9 quadrants. I'm going to show you these one last time. Transpyloric found at the lower border of L1. Subcostal drawn at the upper border of L3. Supracristal body of L4. Transtubercular upper part of L5. These are the 4 planes that will help you to mark the abdomen as per the vertebral levels. Right. So how is abdomen divided into 9 regions? They're all here, 2 vertical lines, 2 horizontal lines. Vertical are the 2 midclavicular planes. Horizontal are transpyloric and transtubercular. Okay. And the 9 quadrants that are formed are here. We will be talking more about it. I won't bother to talk about it here. Come. So the 9 quadrants formed are right hypochondrium, left hypochondrium, epigastrium. Right lumbar, left lumbar, umbilical. Right iliac fossa, left iliac fossa, hypogastrium. Okay? It's nice once in a while to carry out these actions. It kind of keeps you interested in the lecture. Okay? The right hypochondrium, left hypochondrium, epigastrium. Right iliac fossa, left iliac fossa, hypogastrium. In between the 2, right lumbar region, left lumbar region, umbilical region. So practice all this, it's fun. Why are we doing all this? What is the point? See, pain in abdomen is usually either due to inflammation or due to some kind of obstruction. So you would want to know the possible cause of that pain, isn't it? So these quadrants help you to localize the source of pain. Come, I'll show you how. Right hypochondrium pain is there. It's likely to be because of liver or gallbladder. Left is likely to be spleen or left colic flexure, but epigastric region pain is likely to be because of stomach, pancreas or duodenum. Right lumbar and left lumbar are because of kidney, ureter, on the right ascending colon, on the left descending colon. But umbilical is likely to be small intestine, aorta or inferior vena cava. Right iliac fossa, cecum appendix. Left iliac fossa, sigmoid colon. But hypogastrium is likely to be because of urinary bladder, enlarged uterus or small intestine. So you are able to broadly tell what the pain is because of. Okay. Sometimes you will find abdomen being divided just into 4 quadrants. Okay. So you can have the vertical plane and a horizontal transumbilical plane dividing your abdomen into right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. So with this, we complete part 1 of our surface anatomy for surgical precision, abdomen part 1. Okay, so now this will be followed by our surface anatomy of individual organs in the next lecture. Meanwhile, if you like this lecture, then do please like, share, subscribe, and hit the bell icon. Okay? I'll see you in my next video titled Surface Anatomy of Abdomen Part 2, in which we will cover surface projection of major organs like liver, gallbladder, stomach, spleen, pancreas, and some surface projection of vascular structures like aorta, inferior vena cava, and other major blood vessels. So I'll see you in my next lecture. Thank you. Bye.